The member for Calgary East.
Thank you, Mr. Speaker. Alberta's growing population and increased demand for frontline medical care continues to put pressure on our emergency departments. Emergency rooms across the province, particularly in major centres, are experiencing longer wait times, which affects patient outcomes and places additional strain on healthcare staff. To the Minister of Hospital and Surgical Health Services, what is our government doing to address rising emergency room wait times and ensure Albertans can receive timely, critical care when and where they need it?
Good question.
The Honourable Minister of Hospitals.
Thank you, Mr. Speaker. And our government knows that emergency department wait times are too long, which is why we're hiring additional healthcare professionals and physicians, and why the Acute Care Action Plan includes the addition of over 1,000 net new acute care beds in the Edmonton and Calgary area. 2 of these towers will be at the Grey Nuns in Misericordia, and 1 of the bed towers will be at the South Health Campus in Calgary. This builds on the $15 million we've invested to develop 8 new urgent care centres across the province in places like Edmonton, Westview, East Calgary, Lethbridge, Medicine Hat, Cold Lake, and Fort McMurray, Mr. Speaker.
The Honourable Member for Calgary East.
Thank you, Mr. Speaker, and thank you to the Minister. Given that extended surgical wait times can lead to worsening health outcomes for patients who urgently need procedures, and further given that delays in scheduled surgeries place additional stress on hospitals, surgical teams and families across Alberta. To the same Minister, can you please tell us, Assembly, what step is our government taking to reduce surgical wait times and improve access to essential procedures for Albertans?
Members. There's other places to have private conversations. That's not here. The Honourable Minister of Hospitals.
Thank you, Mr. Speaker. We recognize that more must be done to ensure Albertans receive their surgeries within clinically recommended timeframes. That's why our government announced the Acute Care Action Plan, which delivers an additional 50,000 surgeries by expanding partnerships with chartered surgical facilities to perform lower complexity surgeries so we can free up our hospitals to perform more complex surgeries. This builds on the Alberta Surgical Initiative's $265 million in capital for new operating rooms, renovated spaces, and improved equipment to do even higher volumes than the record 318,000 we did last year, Mr. Speaker. And we're going to continue to invest in our surgical programming.
Honourable Member for Calgary East.
Thank you, Mr. Speaker, and thank you to the Minister. Given that improving emergency and surgical wait time requires long-term system planning, strategic investment, and efficient coordination across our healthcare system, and further given that Albertans expect practical solutions that will strengthen hospital capacity and support frontline workers, can the Minister please provide an update on how our government is implementing long-term solutions to enhance hospital efficiency and ensure Albertans receive timely emergency and surgical care?
The Honourable Minister.
Thank you, Mr. Speaker, and to the member for the question. As part of the Acute Care Action Plan, our government is advancing 2 long-term strategies to ensure the health system meets Alberta's needs now and for the decades to come. First, through capital readiness, we are developing a 50-year provincial capital plan to better balance community and hospital investments to ensure infrastructure keeps pace with growth. Second, through workforce resilience, we are creating a long-term workforce plan to strengthen flexibility and to recruit and retain a world-class health workforce, Mr. Speaker. And we're going to continue to invest in our world-class public health care system.